we will think about cephalic presentation. If the presenting part will be soft, we will think about bridge presentation. So during the third Leopold maneuver, during the palpation of the lower abdominal wall or lower uterine segment, we can determine the presenting part. Remember. The next, you should rotate the phantom yourself. Stand back on your patient. Again, you need this position. And during the palpation of the lower uterine segment, we can estimate the fetal head station, descending. It's very important during the vaginal delivery where the fetal head is located. And if you palpate the whole fetal head is above the pelvic brim or in the pelvic inlet. If you palpate only a part of the fetal head, fetal head is in the mid-pelvis. If you don't palpate during the fourth Leopold maneuver fetal head above the pelvic brim, you will understand that fetal head is in the pelvic outlet. So during the fourth Leopold maneuver, during the palpation of the lower uterine segment, we can identify the fetal head station localization. Did you understand? Yes. So, the next part of your correct answer. You will see, for instance, this orientation. And you should say, because your task is estimate the fetal orientation. So you should say the fetal lie, presentation, and position in conclusion. You will describe how we will estimate. But in conclusion, you should say longitudinal lie, cephalic presentation, left occiput, anterior position. And next 4 sentences. I should give this information to my patient, thank my patient, take off my gloves and wash my hands. If you see, please, this orientation.
Longitudinal, anterior.
And now, first lie, then presentation, then position. Longitudinal lie.
Longitudinal lie is cephalic
Presentation.
And right side.
Right. You mustn't say side. Right occiput.
Right occiput. Post.
Anterior position. It's for you.
Longitudinal lie, breech position,
Presentation.
presentation,
Left sacrum. Anterior posterior present, because fetal back is closer to the posterior uterine wall. For you.
Longitudinal lie, breech presentation, right sacrum, posterior
Position, yes. For you.
Longitudinal lie.
Yes. Breech presentation.
Right.
Because this is the right part of the body, patient's body, not your body.
Right sacrum.
Patient sacrum.
Posterior.
Anterior, because closer to the anterior abdominal wall. And for you, please.
Longitudinal lie, breech presentation.
Yes.
Sacral, left sacral.
Left sacrum.
And it's anterior position.
Anterior position. Did you understand this practical skill? Very quickly, demonstrate me practical skill. The first, the second, the third, and the fourth Leopold maneuver. Don't stay between legs. Yes, it's correct. I should find the uterine fundus. Then By my palms, I should palpate the lateral uterine walls or abdominal walls, it doesn't matter. Put and palpate, yes? Because I should find the fetal back for estimation of fetal lie and fetal position. Then, during the third Leopold maneuver, now, rotate the hand. I should palpate the lower uterine segment for estimation of fetal presentation. Yeah, and I can differentiate between cephalic and bridge presentation. And during the vaginal delivery, I will use the fourth Leopold maneuver for estimation of fetal head descending. I will palpate again the lower uterine segment, and I will palpate the presenting part. And I can estimate the fetal head descending, fetal head station. The next part of your answer. The fetal orientation is,
longitudinal lie,
yes,
breech position,
Presentation.
presentation, left side,
you mustn't say
iliac,
left side, left sacrum,
sacrum, anterior.
anterior position. And additionally 4 sentences. Did you understand? The next practical skill is. So the task is determine the estimated date of the delivery and fetal weight. So 7 sentences. And guys, you should say for estimation, for calculation the date of the delivery, I need what information?
Last menstrual period.
No, the first day of the last period. Very important. The first day of the last period. Or menstruation, it doesn't matter. The first day.
Okay.
It's very important because the bleeding is around 5 to 7 days, and you need the first day of the bleeding. So I need the first day of the period. Then I should plus how many days? 7 days, and count back. How many months?
3 months.
3 months. So remember, for calculation of estimated due date, I need the first day of the last menstrual period. I should plus 7 days and count back 3 months. Very easy. And guys, the next. Calculation of the fetal weight. For this manipulation, I need guys, first softness, the next from the back, and I need the navel. And for instance, you should say around 88 centimeters. It doesn't matter. For instance, 90 centimeters. Then, guys, the next my step is I should palpate the pubic symphysis and the 0 point. Yes, the next, look at me. Yes, and again I use my rib, and I should find the uterine fundus in centimeters. For instance, you should say 20 centimeters, it doesn't matter. But you should say the steps of your manipulations. Then, I'm a student. I should multiply both parameters, I mean circumference of the abdomen and the height of the uterus in centimeters. And don't forget, plus 5 points, plus minus 200 grams. If you don't see plus minus 200 grams, you lose 5 points. So the correct answer is, in case of this practical skill, 7 necessary phrases. Then I need the first day of the last menstrual period plus 7 days and count back 3 months. Then my teacher, for calculation of the fetal weight, I need a soft tape. I will measure the circumference of the abdomen at the same height as the navel in centimeters. Then I will palpate the pubic symphysis. I need the 0 at the beginning of the tape. Look, and I should find the uterine fundus in centimeters. Then I should multiply both parameters plus minus 200 grams. I should give this information to my patient. I should thank my patient, take off my gloves and wash my hands. Is it difficult?
No.
No. Did you understand this practical skill? The next, guys.